In healthcare, humility is essential because it's so complicated. I'm an infectious disease physician, but I work with surgeons, OBGYNs. I work with a lot of different specialties and I don't know their specialties. So we have to collaborate to come up with the best in solution for our patient. Like we have a common goal. One of my favorite lines is if you don't have humility, you're likely about to be humbled. And it doesn't matter whether that's healthcare or the business world or sports or wherever, there's just so much complexity in our world that you can't know it all. And you have to rely on other people and be willing to take that in. So yeah, humility is essential.
Welcome to E3, Engage and Empower with Empathy, a podcast brought to you by the Empathy Collective, a consulting firm that empowers leaders and their teams to navigate change through purpose-driven conversations. We are building a community of like-minded leaders and experts who all share the same passion, taking care of people at work. Whether you are a plant manager trying to humanize the factory floor, a small business owner wanting to build a strong culture that lasts, or a corporate executive striving to prevent burnout in your team, you belong in this community. Recently, I was at a spa, of all places, talking with one of the employees who also worked at the local hospital. As she described what it was like there, her words hit me hard. There's so much favoritism among the leaders at the hospital. I much prefer working here at the spa than at the hospital. That conversation stayed with me because if there's one field where empathy should be second nature, it's healthcare. And yet stories like hers reveal something troubling, an empathy gap that's leaving caregivers exhausted and disengaged. That's why I'm so excited for today's conversation with Dr. Josh Hartzell, author of A Prescription for Caring in Healthcare Leadership. With 25 years in military medicine, Dr. Hartzell has seen the best and worst of leadership under pressure. He's a retired Army colonel, an internal medicine and infectious diseases physician, and someone who believes that caring isn't just a moral imperative, it's a strategic one. In this episode, we explore what he calls leadership malpractice, when leaders neglect the human side of their role, and how evidence-based, compassionate leadership can transform the culture of healthcare. We'll talk about what's standing in the way of empathy in medicine, how leaders can balance compassion with accountability, and why the real prescription for better care might start with how we treat one another. This is E3, Engage and Empower with Empathy. Welcome to the show, Josh. It's lovely to have you here. I'm really looking forward to having this conversation. I actually read your book, A Prescription for Caring in Healthcare Leadership. Really good read. I earmarked 50 or 60 pages in here. So fascinating read, I think, for anyone who is in any industry, not just healthcare. So I think a lot of the principles that you outlined in this book are applicable to any leader. And what was interesting for me is I read this book after I had surgery, and I was able to kind of sit in the ambulatory center and watch the staff and observe the staff and how they interact with one another. And what was fascinating to me was they all seemed super happy to be there. And I'm sure you'll appreciate this because this is what you talk about in your book. And the outcome is good leadership in healthcare is you have happy staff, and then those happy staff then treat patients with extra care and compassion. So it was really fascinating to me to observe that and see the enthusiasm from all the staff, and they were helping each other out and taking care of each other. Personally, we all experience the healthcare system, and I think we'll appreciate the kind of behind the scenes that you're going to bring to the conversation today of what happens in the leadership world in healthcare.
Yeah. Well, thanks, Rebecca, for having me on. I'm excited to be able to talk to you about, I think, areas that both of us find incredibly important, empathy and compassion. And I love your story because it's such a great example of a positive culture and the type of culture that we all want to have in healthcare.
Before we get into your book and the principles outlined in your book, let's talk about your career journey.
Sure. Yeah. So my sort of journey, I guess, started with Army ROTC, which in America is sort of the way that you can pay for college by becoming a military officer. So I joined Army ROTC partly for me because I came from a very small town and it was a way for me, one, to pay for my education, two, but I had thought, well, this will give me some really interesting opportunities to do some things that maybe I wouldn't otherwise get to do, which it definitely did. So then I was in this Army ROTC and decided, well, I want to be a physician. So I had the opportunity to go to the Uniformed Services University, which is the military medical school for the US in Bethesda, Maryland. And after that, I became an internal medicine physician and infectious disease physician. And for the early part of my career, focused on clinical care. But over time, really developed a love and passion for medical education. And so got more and more involved with helping medical students and graduate medical education trainees, and ultimately was leading the internal medicine residency program at Walter Reed National Military Medical Center before I retired and moved to my current civilian job. But during that period of developing trainees and thinking about medical education, I developed a really profound interest in leadership development, mainly because what I saw was is that while we were really good at the clinical stuff, that when you graduate your training and you get sort of put in the workforce, it's not the clinical issues that you struggle with, but it's all the leadership stuff. And I sort of recognized that, there was a gap in how we were training people, and given the importance of leadership, felt like this was an area that, we needed to do more. And I love reading and studying about leadership. So was fortunate to be able to really spend like the last 10 years of my career working on helping develop leaders, it really medical student all the way to faculty level, and sort of have now transitioned that also to, researching about leadership as well.
That's really cool, and I love that you kind of fell in love with that piece and were able to dedicate yourself to that mission, throughout your career. Because what I understand, and we'll talk about this in a few minutes, but just reading your book, you talk a lot about how in medical school, there's really not a whole lot of focus on leadership development. So doctors emerge from medical school having that clinical knowledge and the tools in that domain, but not necessarily the leadership development. So that's fascinating to me. And I think you mentioned as well that in nursing school it's different. It may have been in your book.
For most schools, it's not really a focus. And then even when we get to the next level of training in graduate medical education, again, nationally and internationally, most residency programs aren't spending a lot of time focused on leadership development. And then it sort of felt like, oh, you'll do that when you're a staff. But the fact is, when you become a staff, you're really busy. And then, do you step away from your clinical care and other responsibilities to then develop leadership skills? I would argue you should, but it's a challenge. I think what I've seen with nurses that's interesting to me is, and again, this is just my experience, they really sort of crave leadership teaching and development, and they prioritize it for not only their trainees, but once they become staff nurses, they seem to be more engaged with leadership. And they have a lot of different leadership roles, whether it's a charge nurse leading on a floor, whether it's a clinic nurse who's, responsible for leading in a clinic, leading within nursing education. It just seems to be a little more of a priority for them. And again, this is my maybe myopic view of it, but I think generally speaking, all of us could use more leadership education.
And when you say all of us, I'm thinking everyone, not just healthcare. In fact, I've had this conversation with people who've gone through business school, including myself. I've gone through business school, and not once is leadership really taught. We're taught strategy, supply chain, marketing, sales, the finance, all the functional sides of running a business. And it sounds like there's a lot of parallels with what you experienced in medical school. You're dealing with the functional side of being a doctor. Like, this is what you need to learn. These are the tools you need to take care of your patients, which is incredibly important because that is the function of your job. But the leadership component is really overlooked, kind of like parenting. Like, oh, you'll just figure it out once it happens. Like you have your child and then you just figure out parenting. Like, no one teaches you parenting before you have a child. But there's a lot of parallels with parenting and leadership. We're all kind of learning as we go. And I told you about a positive experience I had in with the healthcare system a few months ago. But on the flip side, and you'll appreciate this because I was actually reading your book of all places in a spa. And, because you're sitting there for an hour, I was getting a pedicure. And of course, I'm reading about healthcare leadership while I'm getting my pedicure, as you do. One of the women who was working at the spa, she was helping the woman next to me, and she saw the title of the book I was reading, and she was like, "Hey, are you a healthcare leader?" And I said, "No, I'm not, but I'm interviewing this gentleman on my podcast in a few months, and I study workplace empathy, so I'm really interested in the topic." And she said, "Wow, this is really relevant. I actually work at the hospital down the road." and I do this part time to earn extra cash. And I think she was a nurse assistant or a physician's assistant. I can't remember her specific role, but she said, I really have a tough time working there because it's really toxic and there's a lot of favoritism among the leaders. And so I actually look forward to my time working at the spa because I really don't like going to work at the hospital. So a positive experience, but in this case, is of the very opposite kind of experience that this woman was having as an employee working at that hospital. Why do you think there's an empathy gap in healthcare leadership?
Well, first I'll say that the story makes me, well, one, happy that you're reading my book in the spa. That's exciting. But her story, it makes me sad and a little bit mad that like that's the work environment that she's in. And unfortunately, I don't think that's a unique story for people who are in healthcare. And as to why there is that empathy gap or why it exists, there are probably several reasons for it. I want to start though, just to be clear, no one goes into healthcare to not care about people. And I always remind myself of that everyone has good intentions. It's the execution maybe that is ineffective. And I think that's, also true of business leaders and other leaders in other professions. I like to think that most people are in it for good intentions. And then it's just a lack of really know-how in some ways. And I think for healthcare, the empathy gap is largely created, one, because people maybe have not experienced enough leaders who really lead from that place of caring that they can look to and say, that's the leader I want to be because of the way she took care of the team, because of the culture that she created. So, whatever that environment was that fortunately you had when you were having your surgery, what were those leaders doing? And then those lessons, I would guess, would be carried forward by the people that work in that environment. Similarly, the people who work in the other environment that you were talking about with this lady you met is that's what they see. So that's often then how people lead. They just haven't seen effective leadership. And then on top of that is, again, we talked already about we don't train people how to do this. The thing I try to get people to think about is we know that the number one driver of organizational success is employee engagement. So how do we get employees to be engaged? And the opposite of engagement is burnout. And in healthcare, there is rampant burnout. I mean, there was just a report published this year that showed that we had improved. We were improving, but I think the burnout rate was still like 43 or 48%.
Wow,
And my response was awesome. We're down to 40 some percent of people being burned out,
down to only half.
right? Like great news. We're down to half. And when people are burned out, it leads to depersonalization. And I think it leads to that empathy gap that you're talking about.
Do you think that burnout stemmed from the pandemic, or was it already happening before the pandemic, and then the pandemic just exacerbated it?
Yeah, exactly. I mean, it was certainly prevalent before the pandemic. I think the pandemic initially actually was probably a little bit helpful because people felt a sense of purpose for their work and the value they were bringing. And then that then transitioned to being overworked, under resourced, which I think led to a sort of increase in burnout. And now we're sort of getting back down to maybe like pre-pandemic levels. But this has been a problem in healthcare for a long time. And there's a lot of data around burnout and how burnout leads to, you know, decreased patient safety, decreased patient satisfaction, but it also leads to, you know, substance abuse, suicide among providers. So it's a really big issue, and leading with empathy or leading with compassion is certainly a way that we can, at least in my mind, hope to change that momentum and actually help us sort of push the pandemic of burnout down.
Yeah, I mean, the topic of this episode is healing the healers. And I think we always expect to be healed by the healers as patients, and I know so many healthcare providers really pour their hearts and souls into that patient care. But what does it take to go back to the not just the self-care component from the lens of a healthcare provider, but taking care of each other and as leaders, taking care of your people. And I'm thinking back to a specific example of a retired physician I interviewed a while ago who was also specialized in biofeedback. And he was using biofeedback techniques with his nurse staff because he was seeing burnout in his nurses, and he actually was able to reduce turnover in his nurse staff significantly just by helping them with stress and incorporating some of those techniques that he was using with biofeedback. So that's one example, but like, well, how do we prevent this vicious cycle from continuing to happen and with burnout in healthcare? Like, what's creating all this?
There's a lot of things that are creating it. I mean, I think we've went from a system that was, very patient centered, but we've now driven it to a metric system. How many RVUs do you have? And 5 to 10, 10, 20-minute appointments, whereas these appointments used to be much longer. So we had more time to spend with patients. And I think that focus on numbers and getting through an output has really led many physicians to feel almost like widgets, where it's all about output. Whereas, before it was about the patient and the relationships with the patient. So in some ways we need to get back to that. Fortunately or unfortunately, I think this has led many people to do like concierge medicine, where you can have more time with patients. You can have an hour or longer and you only have a small panel. So you get to really focus on them. The downside of that is obviously that we don't have enough physicians to only do that type of practice. To really fix this, the key word you mentioned to me is prevention. We've been playing catch up for so long rather than thinking strategically about what do we need to do to our system to take care of the healthcare providers. If we take care of the healthcare providers, they will then take care of the patients. And you mentioned retention. So the cost to replace a physician is somewhere between $500,000 to $1 million.
Wow.
So if I leave a practice, I'm not going to be seeing patients during that time, or if I'm surgeon, I'm not operating. There's probably some type of severance package. You have to then pay to recruit and hire somebody new. So it's a lot of money. And what we really need to do is get healthcare organizations to think, okay, well, if it costs that much money, if Rebecca leaves, why don't we invest some of that in some things that will prevent her from leaving? Why don't we hire uh, more support staff? Why don't we buy AI technology to help do some of the note writing? What are the system changes that we can invest in so that people won't leave? That will actually decrease turnover, which again, it saves money. And I'm not in this for money, but if you want to talk about bottom line, there is a financial reason why this would make sense. So I think we really need to move from secondary prevention. It's sort of like once you've had a stroke or a heart attack, okay, now it's secondary prevention versus like, how do we prevent that to begin with? And for too long in leadership, we haven't thought about what we can do really to prevent burnout. It's all about, okay, once you're burned out, how do we support you?
Yeah. I'm just curious because a few minutes ago you mentioned that at one point we were more patient centric and now there's more focus on output and the bottom line. When did that transition happen? I'm seeing this in the business world too. The fine line between focusing on your people versus focusing on your profits, which it to me they go hand in hand. Like there's no do one or the other. The logic to me is you focus on your people and the profits will come. That will be the lagging indicator that you're running a successful business. But I feel like it applies to what you're saying too in healthcare. Do you feel like there's this tension between, okay, we have to meet our operational goals and I'm a doctor and I feel like a widget and I'm just churning out patient after patient so I can meet my goals versus, showing compassion to staff and taking care of staff. Do you feel like there's like an internal struggle with medical professionals in that sense?
Yeah, 100%. And I don't know if you're familiar with the term moral injury, but the idea of moral injury is like we know what we want and should do for patients, but the system is preventing us from doing that. And I think that's a large reason why many providers in healthcare feel burned out, is because they're not able to deliver the type of care they really want to. Right. So I want to spend more time with my patient. I want to get to know them. I want to ask them about their family, but I have 20 minutes in this appointment and I have all these things I have to do. So I can't do that. I want to give them this medication, but to do that, I have to go through all these prior authorization hoops and these other things, and then it's still not going to be approved. So I think the system has created barriers that prevent us from delivering the type of care that we really want to deliver. So to help us with this, we really need to look at our processes and go back and think, okay, how can we change the system to better support the providers? But by doing that, it's ultimately going to better support the people who are delivering the care. One of my favorite stories from the book, talking about prioritizing the healthcare team, is I interviewed Greg Argyros. So he was my program director when I was an internal medicine resident, and he has subsequently become the president of MedStar Washington Hospital Center in Washington, D.C. It's an enormous hospital system, enormous hospital. And he's always put people first, but it's nice to see him do it from this very strategic leadership level. And he talks about how they have 5 strategic pillars: be the best place to work, offer the highest quality of care and for patient safety, offer the best patient experience, be the market leader, and foster financial strength. And what he said was, look, if you do the first 3, be the best place to work, offer highest quality and patient safety care, and the best patient experience, the financial things will take care of themselves. But I think too often leaders in healthcare are focused on the finance part instead of let's just do the work and then the finances will take care of themselves. We really need to refocus that.
So does that just mean changing the way we measure success in healthcare? How is a doctor's success measured? I mean, I am coming this from a place of complete ignorance because I've come from the business world and I know what kind of metrics and KPIs are set typically in the business world, and it's usually focused on execution and output rather than the human component or the how well you are leading your team, for example. So what are those metrics or the KPIs that are being measured?
Yeah, I mean, it really depends on the healthcare system. We often talk about things like number of patients seen, number of procedures done, patient satisfaction, access to care, like how soon can somebody be seen. Whereas we are seeing some systems actually move to outcomes based care. So, for example, are you meeting all the things that this patient should have? So, has the patient had their colonoscopy screening? Have they had their diabetes screening? So, really a focus on the patient outcome and not just how many patients do you see a week? How many procedures do you do a week? Those types of metrics are easy to measure, whereas outcomes are a little bit harder and more challenging to measure because there are obviously things that go into those. Not every patient is built the same in terms of financial ability, social support, underlying feeling about the healthcare system. I think ultimately we need to develop metrics that are going to better support our providers. And that could be patient outcomes, but it could also be the reality that, hey, look, having 15-minute appointments actually doesn't lead to better patient outcomes. I don't know of any data that's ever shown that. If somebody has it, I would love to see it. Right. So maybe seeing less patients per day actually leads to better patient outcomes. We know there's very good data that when you look at providers who are burned out, they have more errors. And we know that medical errors cost our systems a lot of money. We also know that they have less patient satisfaction scores. So if those things are important, then it really needs to be, let's take care of the healthcare provider so that they can deliver the optimal healthcare. But yeah, I think we have a lot of work to go to really just think about what are the best metrics we should be measuring.
Are you trying to help shift this mindset? And are you trying to be a part of this movement to change the way things are being done in the healthcare system? Like,
I still have a day job where I work teaching medical students and faculty about leadership and medical education, and I still see patients. I just came off of a week of inpatient medicine, which helps keep me grounded and understand what the challenges are in the system. But in terms of like my larger goals, I think for me, there are many people who are working on the system and the numbers and the business aspect. What I'm really focused on is trying to get people to think about how we can intentionally lead to take care of the healthcare team. What are those specific behaviors that you can do right now that will help support the people to your left and your right and above and below you? Again, because I think there's that gap in our education system that people just don't know what this looks like. So what I've been trying to do, and the purpose of the book and speaking to different organizations, is to show them what this actually looks like. I just gave a talk yesterday, and somebody raised the question like, well, can you really teach people to care? And, my response was, yeah, I think you can. Whether they truly care or not, I guess that's an internal feeling, but you can teach people these behaviors such as listening. We're not very good listeners. How do we listen more effectively? And when we listen to people, it really demonstrates that we value and respect them. How can we demonstrate gratitude in the workplace? I read a study recently where only about 19% of people get any kind of gratitude every week. And another study, there was a Harris poll, and Reuters talked about it, where like almost 80% of people in the healthcare industry feel undervalued at work.
Hmm.
We all have the opportunity, the ability to say thank you, or to write a thank you card, or to pull someone out and highlight their work in front of their peers. So really, to answer your question, what am I trying to do? I'm trying to show people what are these specific intentional behaviors that we can do that will make people feel cared for. And when you feel cared for, they're going to come to work more engaged. They're going to come to work more motivated. Uh, and if we decrease that burnout, that's going to lead to better patient care.
Yeah. It's almost like, yeah, we have to go back to the basics and learn how to interface well with other human beings, in a compassionate way.
Yeah, the one question I like to ask when I'm doing these talks is, I'll give examples of all these different behaviors, and then I'll ask people, is there anyone in the room who can't treat people with dignity and respect? Is there anyone in the room who is incapable of saying thank you to somebody? Right? And of course, the answer is no. Like, we should all be capable of these things. And boy, if you're not, then that's probably a separate discussion. But yeah, I agree with you. Like, these are not overly challenging things to do. I think they're uncomfortable, some of them. Some of the things that we need to do, like give people feedback, which I've been doing a lot of work around feedback recently, is boy, there is such a fear of giving feedback. People are worried that if I give feedback, it's going to ruin our relationship, or they're not going to like me. Maybe they'll take it out on me. We really have to get over that fear of feedback, because the only way we grow and get better as both individuals and organizations is if we get feedback.
Yeah.
So getting over the discomfort of some of these can also be a challenge. But I also think I've been doing some coaching and helping coach people through these scenarios and giving them different perspectives, or maybe challenging some of their perspectives to think in a different way. It can be really helpful. We've seen a lot of data in the last even year about how coaching, I mean, in the business world, coaching has been going on for a long time, but in the last year or so, coaching in medicine, how that's become a valuable professional development tool for leaders within healthcare.
That's wonderful that you're contributing to that and seeing that gap and going in and using your skills and experience to really support people. Well, I mean, this has been such a great conversation. I love everything that you brought up in this book. It's really just the basic toolkit, but so incredibly important. And the feedback piece is such a great one. I run workshops with leaders and in the business world who, like you said, there's coaching. Coaching has been around for a while in the business world, but even then, the same fears arise with giving and receiving feedback. So I think it's just this human reaction to just kind of resist things that make you a little bit uncomfortable. But discomfort is what creates growth, right?
Yeah, I mean, that is absolutely right. The more uncomfortable we get with some of these, probably the better we're getting, right? Because we're stretching ourselves and stepping into that space. Yeah, feedback, interestingly, I have 3 chapters in the book on feedback. As I was writing about it, it's like, oh, we need to know how to give feedback, but we also need to know how to receive feedback with grace. Like, if someone's willing to give it to me, how do I accept it and make sense of it? And then on an organizational level, how do we encourage feedback as leaders from our teams? Because like you said, it's essential for us to get better.
Absolutely. And I love that you mentioned kind of because the healthcare system tends to be very siloed with specialties. And maybe this is more along the lines of having more humility, but I think it relates to feedback as well as, the anesthesiologist and the nurse and it's like you get so stuck in your area of expertise and it's almost like you don't wanna ask for advice from other areas of expertise, and so then you just get these silos and no one's collaborating or giving feedback to each other, so I think that's specifically important for healthcare where you have all these niche areas of expertise, and how much better would we all be if we all just, gave each other feedback and advice and, put down let go of our egos.
I totally agree. I think in healthcare, humility is essential because it's so complicated. I'm an infectious disease physician, but I work with surgeons, OBGYNs. I work with a lot of different specialties and I don't know their specialties. So we have to collaborate to come up with the best in solution for our patient. Like we have a common goal. I think in the business world, though, it's very similar. It's like there's a lot of complicated things. My brother's a tax attorney and, he has his niche, but the people he works with also have areas that are very specific and very focused on different things. And one of my favorite lines is if you don't have humility, you're likely about to be humbled, right? And it doesn't matter whether that's healthcare or the business world or sports or wherever, there's just so much complexity in our world that you can't know it all. And you have to rely on other people and be willing to take that in. So yeah, humility is essential.
I think that's a wonderful message to leave with our listeners today after this conversation. Thank you again for joining me today and for sharing your insights and your experience in healthcare. And I really appreciate your noble mission to bring more leadership development to healthcare leaders and try to reduce the burnout that we're seeing in such an important profession.
Well, thank you, Rebecca, for having me and shining a light on this topic and for your work with empathy. We need collective voices to spread this message. So I am glad to be part of this larger movement.
If you enjoyed this podcast and would like to hear more, please subscribe wherever you like to listen to podcasts. And if you would like to learn more about the Empathy Collective, check out our website, theempathycollective.com. Life is too short. Let's take care of each other at work so that together we can make this world a better place.